Hi, good morning, Kim. My name is Mihiraa. I'm your invigilator for the OET speaking session on the 3rd of February 2024. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name, for the record, please?
My full name is Kim Samuel.
All right, Kim, could you please confirm your candidate number?
Yes. My candidate number is 432333428.
Fine. Are you taking this test as a nurse?
Yes, I am.
Okay. Can I see your ID, please?
Sure. Here it is.
Thank you. Now, let's move on to the warm-up session. The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right, Mihiraa.
How do you stay updated on the latest medical advancements?
I regularly attend conferences, subscribe to reputable medical journals, and participate in continuous education programs to ensure I stay informed about the latest developments in the field. Additionally, I engage in peer discussions and collaborate with colleagues to exchange insights and best practices.
How do you handle a challenging patient who disagrees with your recommended treatment?
I believe in open communication. I would listen to their concerns, provide additional information, and work collaboratively to find a solution that aligns with their values, while ensuring their health is prioritized. Additionally, I'm open to seeking second opinions when necessary to explore alternative perspectives.
Describe a situation where you had to make a quick medical decision. How did you handle it?
During a critical emergency, I relied on my training and experience to swiftly assess the situation, prioritize interventions, and communicate effectively with the team to ensure prompt and appropriate care for the patient. In such scenarios, maintaining a clear-headed approach and decisive action are paramount.
How do you balance empathy with maintaining professional boundaries?
Empathy is crucial in patient care, but it's essential to maintain professional boundaries. I ensure empathetic communication while upholding ethical standards, respecting confidentiality, and prioritizing the patient's well-being. Additionally, I seek regular self-reflection to ensure a healthy emotional balance in my interactions.
How do you handle a high-stress situation in the hospital?
I remain calm and focused under pressure, relying on my training to prioritize tasks effectively. Communication with the team is key, ensuring everyone is on the same page to provide the best possible care in intense situations. Furthermore, I emphasize debriefing sessions after such events to promote continuous improvement and emotional well-being among the healthcare team.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No, Mihiraa.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when the 3 minutes are up. You can ask me if there is anything you are not sure about, and you can make notes on the role-playing card if you want to. Here's a pencil for making notes.
Thank you, Mihiraa.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your OET speaking role play. Don't worry if I stop you when the time is up.
Good morning, I am Dr. Kim Samuel. Could you confirm your name and age, please?
My name is Mihiraa. I am a 63-year-old doctor.
Thank you for the verification. What brings you here today, Mihiraa?
Well, I feel a bit silly coming to the doctor. I hope I'm not wasting your time, but I read this article in the newspaper about tetanus, and it got me worried.
Don't worry at all, Mihiraa. It's always better to be safe than sorry. What specifically concerned you about the article?
It mentioned people over 50 getting tetanus from simple garden wounds. 6 days ago, I actually stepped on a rusty nail while gardening, and it went through my sandal and scratched my foot. I cleaned it properly, but now I'm worried.
I see. It's good that you came in. Mihiraa, can you describe how the wound is now, and have you noticed any symptoms since the incident?
No, doctor. It's just a bit tender around the wound. No other symptoms, thankfully. Is that so serious, doctor?
Well, Mihiraa, I'd like to check if you're experiencing any symptoms of tetanus, commonly referred to as lockjaw. Symptoms may include muscle stiffness and spasms, particularly in the neck area, with a notable stiffness in the jaw. These signs typically manifest between 4 to 21 days after an injury. Have you noticed any unusual sensations or symptoms since the incident in your garden?
Oh, it sounds hard. Well, I haven't had any of these.
That's great to hear, Mihiraa. Tetanus, often associated with the colloquial term lockjaw. The condition is characterized by muscle stiffness and spasms, primarily affecting the neck muscles. Notably, individuals may experience a pronounced stiffness in the jaw, giving rise to the term lockjaw. This stiffness extends beyond the jaw, encompassing various muscles in the body. Tetanus poses a serious threat, as it affects the nervous system and muscles, leading to potentially severe complications, if left untreated. Identifying and addressing these symptoms promptly is crucial for effective medical intervention and preventing the progression of the disease.
Oh dear, that sounds terrible. But I thought I had a tetanus shot when I was a child. Was the article exaggerating then? Doesn't that provide lifelong immunity?
Mihiraa, I want to reassure you that coming in for this consultation was a wise decision. It's crucial to prioritize your health, especially considering the nature of your injury. While childhood tetanus vaccinations offer good protection, immunity can weaken over time, especially as we age. Also, the tetanus vaccine typically requires a booster every 10 years, as our immune system's effectiveness can diminish with age. Given that information, if your last vaccination was more than 10 years ago, I would strongly recommend getting a tetanus booster. It's a precautionary measure to ensure your continued protection against tetanus and to maintain your overall well-being. If you're comfortable with it, we can proceed with scheduling the vaccination for you.
I see, I should go for it. Doctor, is it safe for me to continue gardening at this age? Even though I enjoy it, being safe is the priority.
Mihiraa, it's wonderful to hear that you enjoy gardening. Engaging in outdoor activities like gardening is not only a source of pleasure, but also an excellent form of exercise. The fresh air, sunshine, and physical activity contribute significantly to your overall well-being. Don't let this incident deter you from pursuing your gardening hobby. In fact, maintaining an active lifestyle is beneficial for your health. Just remember to take precautions, such as wearing suitable footwear, to prevent any future injuries.
Thank you, doctor. That makes sense. Prevention is better than cure.
Mihiraa, to ensure your safety while gardening and to prevent future injuries, it's essential to invest in suitable footwear. Opt for strong, closed-toe shoes that cover your entire foot. Shoes with thick soles provide an additional layer of protection, reducing the risk of injuries from sharp objects or uneven terrain. These precautions will not only enhance your gardening experience, but also minimize the likelihood of accidents.
That's a good idea. That's excellent advice, doctor. I'll definitely get new shoes. I wouldn't want to risk anything. I will take a tetanus booster vaccination as well.
That's perfect, Mihiraa. You're very welcome. Remember, don't hesitate to seek medical advice if you have any concerns, no matter how small they may seem.
Definitely, doctor. I'll be sure to remember that.
Thank you, Mihiraa. I wish you a speedy recovery.
Thank you so much for your time and reassurance. That is the end of your OET speaking role play. All the best.
Thank you, Mihiraa.
Thank you for watching. Please like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.